I'm going to be performing a full abdominal exam on my patient, Mr. Smith here. First, in this video, I am going to inspect the abdomen and I'm going to auscultate. And then in the concurrent videos, I'm going to do percussion and palpation. I've already asked my patient to use the washroom if he needs to, and I have him draped with a blanket so he's warm, got a gown on, and got a bolster under the knees so he's comfortable. Some of the arm positions might be a little bit different than what's indicated in our manuals because Mr. Smith here just got a fresh tattoo on his upper right arm, so I'm going to be a little extra careful how we're situating that arm so there's no pain there. So first I'm going to begin with my inspection, and normally I'd be on a higher table and standing up. I'm just going to sit for a couple of the beginning portions just so I'm a little bit closer and it's easier on my back. So first, can I have you with your arms at your sides? Perfect. And is it okay if I lift your gown up?
Yep, that's fine.
Okay, thank you. So first we're going to expose the abdomen here. And I'm just going to do an overall general inspection. So I'm looking for any distension of the abdomen, which I'm not seeing. Any pulsations of the abdomen, indicative of maybe anything going on with the aorta, but I'm not seeing any of that. Then looking for any types of scarring and looking for any sort of bruising, Cullen sign around the belly button or the umbilicus, and then Gray Turner sign on the flank. Not seeing any bruising there. And no cafe au lait spots, no major asymmetries or anything distended or protruding from the abdomen. So as far as the inspection goes, he looks all clear. And next I'm going to do auscultation. The first part of the auscultation is to listen for the digestive sounds. And I want to make sure that I have the diaphragm turned on my stethoscope. And I want to start in the right upper quadrant and move clockwise from there. If there was pain in the upper right quadrant or any other quadrant, I want to do it in such a way so the painful or tender quadrant is last. And Mr. Smith, do you have any pain?
I do not.
He has no pain, so we're going to start in that right upper quadrant. And I want to make sure I warm up that diaphragm. So typically, I would listen for 1 whole minute in one spot in each quadrant. But for the sake of this video, I'm not going to spend a minute in each quadrant. But what I'm listening for in those 4 quadrants is I just want to listen for normal bowel sounds. Any type of gurgling or bubbling type sounds are normal. If Mr. Smith had an absence of bowel sounds, that could be indicative of peritonitis. And if he had increased bowel sounds in that full listening sequence, then that could be an indicator of an early bowel obstruction. And sometimes around like the sigmoid colon area, you may have a lack of bowel sounds because the patient needs to have a bowel movement. But as far as everything I could hear quickly, we had normal bowel sounds. So if all the bowel sounds are good, then I'm going to move on and listen to some of the circulation. So we'll start with the abdominal aorta. So the abdominal aorta, we can listen once we get past that xiphoid process, but above the umbilicus is the region where we can find a good piece of that abdominal aorta before the bifurcation. So I'm going to flip that to the belt of my stethoscope and then make sure it's warm and then place that over the abdominal aorta. And typically you won't hear anything in a healthy, normal, not distended aorta, but I am listening for brutes, which I don't hear any. And then same thing, I could listen for the renal arteries and the iliac arteries. For the renal, you would go 2 inches above the umbilicus and then over about 2 inches, and that would give me the renal arteries, listening for the same thing, listening for brutes. And then iliac arteries, bifurcations at the umbilicus, 2 inches down and then about 2 inches to the right, 2 inches to the left would give you those iliac arteries. And then the last thing is to listen to the portovenous system, and I'm just going to listen around the area of the umbilicus and then in the epigastric area. So just going around that umbilicus, checking for any venous hums.